Good afternoon, ladies and gentlemen. I am delighted to have this time slot available for sharing to you our results obtained from the impact assessment of a 4 years multi-sectoral community-based food security program which was implemented in the northern and mountainous areas in Laos. The study is applying a pre-post assessment methodology and is following up interventions at the different sectors, and interventions were implemented in the sector of food availability, food access, food availability, water and sanitation, additionally on health, hygiene, behavior change, nutrition promotion. And the impact the project achieved over these 4 years was tremendous. The project was able to contribute to reduced child malnutrition, and looking at chronic malnutrition in children under 5 was reduced by minus 3.9% annual reduction rate. This is compared to the region where the chronic malnutrition was reduced by minus 2.5%, quite a big success. Whereas at the same time, at the national level, Laos, there was no improvement measured. Similarly, the child mortality rate was reduced from 250 deaths per 1,000 live births down to 100 deaths, which was a tremendous success as well, and brought the child mortality down to national rates. Significant achievements also in the reduction of acute malnutrition as well as mothers underweight. Now, when we look at the indirect causes of malnutrition, there were successes achieved in changed behavior, hygiene behavior, in access to food, and also in increased income. So, for example, the access to rice had increased by 30%. So there was much more rice available and easily accessible and available at the household. The income over those 4 years increased by 50%. So both of those results indicate extreme good impacts on improving availability and access to food, and also in reducing poverty. Nevertheless, when we look at the causes, or when we look at the determinants that have really triggered the changes, it was not the increased income and it was not the increased rice availability that had contributed to the improvement of nutritional status of the children, but there were 3 major factors very clearly triggering the changes, the improvements in chronic malnutrition. And those 3 factors were access to or adoption of an improved agricultural system. So not the increased rice production, but an improved agricultural production system, increased productivity. Secondly, it was the change in hygiene behavior, measured by, for example, boiling drinking water, other environmental hygiene measures. And it was the access to the increased quantity and quality of drinking water. Those 3 factors triggered the changes. And households that had adopted those 3 improved practices had a child malnutrition rate of 25% only, compared to those households that did not adopt any of those 3, which remained at 75%, which was actually the child malnutrition rate at the beginning of the project. Yes. And I would also like to mention, when we did an analysis of determinants at the beginning of the project, it was the educational status of the parents, as well as the decision-making power of the women in the household, decision-making power over livestock, decision-making power over cash money, over use of cash, decision-making over the use of rice. Empowerment of women and education were the major determinants of malnutrition in this setting. We're looking at this group where women were empowered and had education, primary education. We had only 25% of the children being malnourished, compared to others of illiterate parents or parents where women did not have any decision-making power, of 75% chronic malnutrition. So overall, I would like to support the conclusions, and I think we have heard at the plenary and at the different discussion panels very often already, that it is not only the agricultural growth, it's not only poverty reduction, but this is a necessity and needs to be complemented by additional activities, by additional support, which can enhance the impact on the improved nutritional status of the children. Thank you very much.